Today we're going to talk about what is meant by hormonal acne. I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute, and we're a very specialized dermatology practice. We treat only acne. That's all we do. And we're very unique in that regard. So we have very special insights that we try to offer as educational opportunities for those who are navigating the path toward clear skin. However, none of this information is meant to be medical advice. So I have a lot of patients that ask me, is my acne hormonal? Because they suspect that hormones must be involved in the production of their pimples. And the answer is yes. All acne has hormones at its roots. One of the first steps in acne formation is the interaction of hormones in the acne-prone pore. And hormones trigger the oil gland to begin to become excessively active. It makes excessive amounts of oil. It becomes very overactive, and a number of changes occur in the oil gland so that the oil gland no longer functions normally. It becomes closed off, it shuts down, it becomes swollen and inflamed, and it produces a pimple. So hormones are one of the areas that we target when we're treating acne, especially in women. So what is meant when someone says, oh, I have hormonal acne? Well, typically that's an arbitrary designation. There's really no such thing as something that is hormonal acne as opposed to any other form of acne, because as I said, acne always has hormones as one of the components at the roots of its formation. But there is an arbitrary designation that we refer to as hormonal acne. I like to refer to it as hormonal pattern acne because it is just a pattern of acne breakouts, not really something that is caused by hormones as opposed to other forms of acne. So in that hormonal pattern of acne, it tends to accumulate around the lower face and the jaw lines, underneath the chin, on the neck areas. Those are favorite areas for patients who have this hormonal pattern of acne. And one of the things that we do recognize is that this form of acne tends to be a little bit more resistant to treatment than other forms of acne. So sometimes we like to be a little bit more aggressive in the beginning and use medicines that we think are going to be more effective. A couple of the medicines that we know can be more effective are spironolactone for women, for example, which is a medication, it's a pill that works by actually blocking the effects of those acne-causing hormones on the pore. So it gets right to the root of the problem and can be very effective. Another medicine that we often resort to is Accutane, which is the most effective medicine of all. So by using Accutane, we can often have a very successful treatment for hormonal pattern acne and achieve clear skin. So hormonal acne or hormonal pattern acne is something that we encounter all the time. It's very common. It's very treatable, although it is a little bit more resistant in the beginning. So we like to use more effective remedies right from the start.